Are you feeling stuck in negative patterns of thought and behavior? Do you want to improve your emotional well-being and live a more fulfilling life? If so, you may want to consider cognitive behavioral therapy, or CBT for short. In this video, we'll explore some of the most effective CBT techniques that can help you to break free from negative patterns and achieve your goals. So sit back, relax, and get ready to learn more about how CBT can transform your life. Cognitive behavioral therapy is a widely used psychotherapeutic approach that focuses on changing negative patterns of thought and behavior to improve emotional and mental health. It is based on the idea that our thoughts, feelings, and behaviors are interconnected and influence one another. CBT techniques aim to identify and modify negative thoughts and behaviors, which can result in improved emotional regulation and a more positive outlook on life. Some of the key techniques used in CBT include: Psychoeducation is a therapeutic technique that involves providing clients with information about their condition and treatment options. It is often used at the beginning of therapy to help clients better understand their symptoms, the causes of their condition, and what they can expect from therapy. The goal of psychoeducation is to empower clients by providing them with knowledge and understanding of their condition, as well as the tools to manage their symptoms. Psychoeducation can cover a wide range of topics, depending on the client's specific condition and needs. For example, clients with depression may be provided with information about the symptoms of depression, the causes of depression, and the various treatment options available. Clients with anxiety may be provided with information about the different types of anxiety disorders, the physical and emotional symptoms of anxiety, and techniques for managing anxiety, such as relaxation exercises or exposure therapy. Psychoeducation can be delivered in a variety of ways, such as through informational handouts, videos, or group sessions. It can be tailored to the client's specific needs and can be delivered by a mental health professional, such as a therapist or psychologist, or by a medical professional, such as a psychiatrist or primary care physician. Overall, psychoeducation is an important component of mental health treatment, as it can help clients feel more informed and in control of their condition. By providing clients with knowledge and understanding of their condition and treatment options, psychoeducation can help clients make informed decisions about their treatment and improve their overall quality of life. Behavioral activation is a therapeutic technique that is often used to help clients overcome feelings of low motivation and sadness. It is based on the premise that engaging in activities that are enjoyable or rewarding can help improve mood and increase a sense of purpose in life. Behavioral activation involves identifying specific activities that the client enjoys and creating a plan to engage in them regularly. The first step in behavioral activation is to identify activities that the client finds enjoyable or rewarding. This can include activities such as socializing with friends, engaging in hobbies or interests, or participating in physical exercise. The therapist and client work together to identify activities that are achievable and enjoyable, as well as activities that the client may have previously enjoyed but stopped doing due to depression or other factors. Once the activities have been identified, the therapist works with the client to create a plan to engage in these activities regularly. This can involve setting goals for the week and scheduling specific times to engage in the identified activities. The therapist may also help the client to identify any barriers or obstacles to engaging in these activities and develop strategies to overcome them. The goal of behavioral activation is to increase the client's sense of purpose and improve their mood. By engaging in enjoyable and rewarding activities, the client may begin to experience a sense of accomplishment and satisfaction, which can help improve their self-esteem and overall sense of well-being. Behavioral activation can also help clients to develop new coping strategies and improve their ability to manage depression and other mood disorders. Overall, behavioral activation is a valuable therapeutic technique that can help clients overcome feelings of low motivation and sadness. By identifying enjoyable and rewarding activities and creating a plan to engage in them regularly, clients can improve their overall sense of well-being and increase their motivation to participate in life. Cognitive restructuring is a therapeutic technique that is used to help clients identify and change negative thinking patterns. It is based on the premise that our thoughts, beliefs, and attitudes can impact our emotions and behaviors. Cognitive restructuring involves identifying negative thought patterns and replacing them with more positive and accurate ones. The first step in cognitive restructuring is to identify negative thinking patterns. These may include cognitive distortions, such as all-or-nothing thinking, catastrophizing, or overgeneralization. The therapist works with the client to identify specific instances where these negative thinking patterns are occurring and to challenge the accuracy and validity of these thoughts. The next step is to replace the negative thinking patterns with more positive and accurate ones. This can involve reframing negative thoughts in a more positive light or challenging them with evidence or alternative perspectives. For example, a client who thinks I'm a failure because I made a mistake can be encouraged to reframe their thinking to I made a mistake, but that doesn't mean I'm a failure. Everyone makes mistakes, and I can learn from this experience. Cognitive restructuring can be done through various techniques, including journaling, role-playing, or thought diaries. The therapist may also use guided imagery or relaxation techniques to help the client become more aware of their thoughts and emotions and to reduce negative thinking patterns. The goal of cognitive restructuring is to help clients develop more positive and accurate thinking patterns, which can lead to improved emotional well-being and better coping strategies. By changing negative thinking patterns, clients can develop a more realistic and positive outlook on life and improve their ability to manage stress, anxiety, depression, and other mental health concerns. Overall, cognitive restructuring is a valuable therapeutic technique that can help clients identify and change negative thinking patterns. By challenging negative thoughts and replacing them with more positive and accurate ones, clients can improve their overall well-being and develop better coping strategies for managing mental health concerns. Exposure therapy is a therapeutic technique that is commonly used to treat anxiety disorders, such as phobias, post-traumatic stress disorder, and obsessive-compulsive disorder, OCD. It involves gradually exposing the client to feared situations or stimuli in a controlled and supportive environment to help them overcome their fears. The first step in exposure therapy is to identify the specific feared stimuli or situations. This could include objects, places, people, or situations that trigger anxiety or fear in the client. The therapist and client work together to develop a hierarchy of these feared stimuli, starting with the least anxiety-provoking and gradually working up to the most anxiety-provoking. Once the hierarchy has been established, the client is gradually exposed to each feared stimulus in a controlled and supportive environment. This can involve imaginal exposure, where the client is asked to vividly imagine the feared situation or stimulus, or in vivo exposure, where the client is exposed to the feared situation or stimulus in real life. The therapist may also use relaxation techniques or cognitive restructuring to help the client manage their anxiety during the exposure process. The goal of exposure therapy is to help the client overcome their fear and anxiety by providing them with a safe and supportive environment to face their fears. By gradually exposing the client to the feared stimuli, the client can learn to manage their anxiety and develop coping strategies for managing their fears in the future. Exposure therapy has been shown to be an effective treatment for anxiety disorders, with many clients experiencing significant reductions in symptoms. It can also be used in combination with other therapeutic techniques, such as cognitive restructuring or mindfulness, to help clients develop a more comprehensive set of coping strategies for managing their anxiety and improving their overall quality of life. Overall, exposure therapy is a valuable therapeutic technique that can help clients overcome their fears and anxieties. By providing a safe and supportive environment for exposure to feared stimuli, clients can learn to manage their anxiety and develop coping strategies for managing anxiety and fear in the future. Relaxation techniques are therapeutic techniques that aim to reduce stress, anxiety, and physical tension in the body. These techniques are commonly used in the treatment of mental health concerns, such as anxiety disorders, depression, and post-traumatic stress disorder. There are several different types of relaxation techniques, including progressive muscle relaxation, deep breathing, visualization, and meditation. Progressive muscle relaxation involves tensing and relaxing different muscle groups in the body to reduce tension and promote relaxation. Deep breathing involves taking slow, deep breaths to calm the body and reduce stress. Visualization involves imagining a peaceful or calming scene or image to promote relaxation. Meditation involves focusing on the breath or a particular object to calm the mind and reduce stress. Relaxation techniques can be practiced in a variety of settings, including at home, in a therapy session, or in a group setting. They can be used as a standalone technique or in combination with other therapeutic techniques, such as cognitive behavioral therapy or exposure therapy. The benefits of relaxation techniques are numerous. They can help reduce stress and anxiety, promote feelings of calm and relaxation, and improve overall well-being. Relaxation techniques can also help individuals manage physical symptoms of anxiety or stress, such as muscle tension, headaches, and stomach aches. Overall, relaxation techniques are a valuable therapeutic tool for promoting relaxation and reducing stress and anxiety. By incorporating relaxation techniques into a treatment plan, individuals can develop coping strategies for managing mental health concerns and improving their overall quality of life. Problem-solving techniques are a type of therapeutic technique that aim to help individuals identify, evaluate, and resolve problems in their lives. These techniques are commonly used in the treatment of a variety of mental health concerns, including depression, anxiety, and substance abuse. The first step in problem-solving techniques is to identify the problem. This may involve clarifying the issue, defining the problem, and understanding the underlying causes or contributing factors. Once the problem has been identified, the individual and therapist work together to develop a plan for resolving the problem. This plan may involve brainstorming possible solutions, evaluating the pros and cons of each solution, and selecting the best course of action. The plan may also involve developing specific goals and objectives, as well as identifying the resources and support necessary to achieve those goals. Throughout the problem-solving process, the therapist may also work with the individual to develop skills in communication, conflict resolution, and decision-making. These skills can help individuals better manage and resolve problems in the future. The benefits of problem-solving techniques are numerous. By providing individuals with a structured approach to problem-solving, these techniques can help individuals feel more in control of their lives and more confident in their ability to manage problems. Problem-solving techniques can also help individuals develop more effective coping strategies for managing stress, anxiety, and other mental health concerns. Overall, problem-solving techniques are a valuable therapeutic tool for helping individuals identify, evaluate, and resolve problems in their lives. By incorporating problem-solving techniques into a treatment plan, individuals can develop the skills necessary to manage mental health concerns and improve their overall quality of life. Mindfulness techniques are a type of therapeutic technique that aim to help individuals develop awareness and acceptance of their thoughts, feelings, and bodily sensations in the present moment. These techniques are commonly used in the treatment of mental health concerns, such as anxiety, depression, and substance abuse. The primary goal of mindfulness techniques is to help individuals become more aware of their thoughts and feelings without judgment or criticism. This can involve practicing meditation, breathing exercises, and other mindfulness exercises that promote present-moment awareness and acceptance. One of the most common mindfulness techniques is mindfulness meditation. This involves focusing on the breath or a particular object and observing the thoughts and feelings that arise without judgment. Mindfulness meditation has been shown to have numerous benefits, including reducing stress, anxiety, and depression, as well as improving overall well-being and quality of life. Other mindfulness techniques may involve body scans, where individuals focus on different parts of their body and observe any physical sensations, or mindful movement exercises, such as yoga or Tai Chi. The benefits of mindfulness techniques are numerous. By developing awareness and acceptance of their thoughts and feelings in the present moment, individuals can learn to manage stress, anxiety, and other mental health concerns more effectively. Mindfulness techniques can also promote greater self-awareness, self-acceptance, and compassion for oneself and others. Overall, mindfulness techniques are a valuable therapeutic tool for improving mental health and overall well-being. By incorporating mindfulness techniques into a treatment plan, individuals can develop the skills necessary to manage mental health concerns and improve their overall quality of life. Thought records are a common technique used in cognitive behavioral therapy, CBT, to help individuals identify and challenge negative thoughts and beliefs that contribute to negative emotions and behaviors. The process of thought records typically involves identifying a negative thought or belief, and then examining the evidence for and against that thought or belief. This can help individuals gain a more balanced perspective and challenge the validity of negative thoughts or beliefs. There are typically 5 steps involved in creating a thought record. Identify the negative thought or belief. Write down the emotions associated with the thought or belief. Identify the evidence that supports the thought or belief. Identify the evidence that contradicts the thought or belief. Generate a more balanced, realistic thought or belief. For example, if someone experiences social anxiety and has the thought, "Everyone at this party is going to judge me," the thought record process would involve examining the evidence for and against this thought. The therapist might ask the client to identify specific examples of times when people have judged them at parties in the past, as well as times when they have not been judged. The therapist might then help the client generate a more balanced thought, such as some people might judge me, but not everyone will, and even if someone does, it doesn't mean that I am a bad person. By challenging negative thoughts and beliefs through thought records, individuals can learn to develop a more balanced and realistic perspective, and reduce the negative emotions and behaviors associated with negative thinking patterns. Thought records can be a valuable tool for individuals dealing with a range of mental health concerns, including anxiety, depression, and low self-esteem. Graded exposure is a cognitive behavioral therapy technique that involves gradually exposing individuals to feared or anxiety-provoking situations or stimuli. The process involves breaking down the feared situation or stimuli into smaller, less anxiety-provoking steps, and gradually increasing exposure over time. The goal of graded exposure is to help individuals learn to tolerate and eventually overcome their fear or anxiety, by building up their confidence and coping skills. Graded exposure is often used in the treatment of anxiety disorders, such as phobias, panic disorder, and post-traumatic stress disorder. The process of graded exposure typically involves several steps. The therapist will work with the individual to identify the feared situation or stimuli, and then break it down into smaller steps or stages. The individual will then practice facing each step, starting with the least anxiety-provoking step and gradually progressing to more challenging steps. For example, if someone has a fear of flying, the therapist might break down the exposure process into steps, starting with looking at pictures of planes, then watching videos of planes taking off and landing, then visiting an airport, and eventually taking a short flight. By gradually exposing individuals to feared situations or stimuli, they can learn to develop greater confidence and tolerance, and eventually overcome their fear or anxiety. Graded exposure can be an effective tool for individuals dealing with a range of anxiety disorders, and can help them improve their quality of life and ability to engage in meaningful activities. Systematic desensitization is a form of cognitive behavioral therapy that is used to help individuals overcome anxiety and phobias. This technique involves gradually exposing the individual to the feared stimulus or situation, while teaching them relaxation techniques to help them manage their anxiety response. The process of systematic desensitization typically involves several steps. The therapist will work with the individual to identify the feared stimulus or situation, and then teach them relaxation techniques such as deep breathing, progressive muscle relaxation, or visualization. The individual will then practice these relaxation techniques while imagining or visualizing the feared stimulus or situation. The therapist will gradually increase the intensity of the imagined or visualized stimulus, while continuing to help the individual maintain a relaxed state. Over time, the individual will become desensitized to the feared stimulus or situation, and their anxiety response will decrease. Systematic desensitization can be an effective tool for individuals dealing with a range of anxiety disorders, including phobias, social anxiety, and post-traumatic stress disorder. It is important to note that systematic desensitization should always be done with the guidance of a trained therapist, as exposure to the feared stimulus or situation can be overwhelming and trigger intense anxiety or panic attacks. A therapist can help individuals progress through the exposure process at a pace that is comfortable and manageable for them, and provide support and guidance throughout the process. Thanks for watching. I hope this video has provided you with a better understanding of cognitive behavioral therapy techniques. Remember, CBT is a highly effective form of therapy that can help you to identify and change negative patterns of thought and behavior, ultimately leading to greater emotional well-being and a more fulfilling life. If you found this video helpful, please consider subscribing to our channel for more informative content on mental health and wellness. Thank you again for watching, and we'll see you in the next video.